Record on this computer. Let's see if we can get this. We'll try one time. Nope, we're not. It says that we're not live streaming. Okay, we're just going to record the video and we will push it out there later. Hello, everybody. My name is Dr. Jennifer Gardella, and I am one of the consultants that work with a fabulous group over at BCHIP. Kim Everett, our commander-in-chief over there. That's a really good title for you. Kim, you mentioned something last week that we are going to talk about, the BCHIP strategic plan. My little ears went up. I was like, oh, we need to get this on video so everyone can hear it. So why don't you introduce yourself and the work that you guys do, and then we'll dig into the strategic plan.
Perfect. So hello, everyone. And Jennifer, thanks so much for providing the services for us to do the recording today. BCHIP is a nonprofit organization that is supported by our 6 county health systems, the Bucks County Medical Society, and our county Department of Health to address gaps in healthcare. It's been around for a long time, so we have a significant history and footprint here in Bucks. But believe it or not, for the many years that they've been around, they did not have a strategic plan, at least one that I've been able to locate as I took control. So we were really excited. We did receive some funding support from our friends at Foundation Community Partnership to be able to actually implement the process of doing a strategic plan. And then, interestingly enough, the Bucks County Intermediate Unit does provide a service for nonprofit organizations to help with strategic planning. Fee for service, but it's very nominal, based on or considering other proposals that we received. So they provided a great service, and they are on our board here at BCHIP as well. So we were really happy to have their support to do that.
Fabulous. So how is the strategic plan organized? Is it organized by like department? Is it organized by initiative?
More by initiative. And really what we started with, first of all, it's just a great process for me because I've never been involved directly in strategic planning. So it was a great learning process for me personally here at BCHIP. And what was great is we're able to tie the strategic plan to our health system's community health needs assessments. Great. So for folks who don't know, all hospitals, all nonprofit hospitals are required to do a community health needs assessment. And they do that by evaluating data internally and then meeting with their stakeholders and identifying their priorities. And in Bucks County, several of the hospitals came together and used a service to do that. And we know that mental health was identified as a first priority related to the community health needs assessment. Access to care is another priority. Chronic disease prevention and management is another. Substance abuse and related disorders. And then violence, housing, and a few others kind of really were elevated to the top. So what we did is we met with each one of our board members, and then we also met with key stakeholders. So we brought all the nonprofit players to the table. So the Opportunity Council, Family Service Association of Bucks County, NOVA, A Woman's Place, all those folks came together. We had multiple strategic planning meetings to get their input as to how they felt, not just what were the needs of the community, but where they felt BCHIP was best positioned to make a difference in those needs.
Okay.
And so there were 3 major opportunities that were identified. And the first, which I thought was really, really interesting, was improving the identification of needs specific to behavioral health, violence, and social determinants of health. So we are not in a position, we're not always a direct service provider. We do provide some service, advanced care planning and smoking cessation, some of the things we've talked about on here before. But what we know is that we really don't have a great picture of how some of these things are impacting people's health. So for instance, when Family Service Association got a grant for street outreach to do street medicine, they came to me and they said, we want to know how many folks that are experiencing homelessness are utilizing the emergency department. And when I went to our 6 hospitals, the majority of them were not able to provide me that information.
Oh my gosh.
It's just not able to be extracted in a way that a health system typically captures it. It's not that they don't know. They ask this question and they meet the needs of the patients, but it's not captured in a way that can be extracted from a data perspective, if that makes sense.
Yeah.
So there are ways to do that. And there are systems that could be helping us do that better. And so identifying those resources and then implementing them is one of the things that was identified as a priority, because how do we really know? So when Family Service Association did go get that grant, and they have street outreach, and they're doing this amazing job of doing street outreach, but how do we know whether it's really having an impact on emergency department utilization or hospitalizations? And we don't. So we're starting to now, because we're putting it in place just for that one program, but that's just one example. So when we're talking about patients with substance use disorder or mental illness, think about the fact that if someone was experiencing an overdose, or if they were having a mental illness, that they were in crisis, and maybe they were angry and they punched something, and they come to the hospital possibly with a broken bone, it's very possible that sometimes from a data perspective, when we pull data, that person would not come up on the radar for a person with substance use disorder or mental illness. They'd come up for a broken hand.
Right.
So we're missing a lot of data when it comes to the health systems and the way they are tracking things. We have some, but what we have, I don't want to say is 100% accurate. And so there's ways to improve that. So BCHIP was looked at as a role, or as someone who could do that in all 6 health systems here in Bucks County.
That's amazing. And one thing that I've learned in my advanced years as I collect wisdom here is that data is the conduit to money. So if you want financial support, especially from the government, you need to back up your requests, every grant, with substantial data. And in some of these cases, it's really hard for you to say, we have 20 homebound people and they all got vaccinated or whatever. That collecting that data is actually time consuming, and it needs to be done very carefully, or else people get mislabeled, and then your data, all that happens too. So it's great to hear that you're drilling down and collecting the data, because you'll need it.
Exactly. So there's lots of projects that'll be built around that. One of the other opportunities that were identified is just expanding and improving our collaborations and partnerships. So, that's happening very uniquely with our healthcare staffing collaborative. Just had a meeting today with the workforce and economic development folks, and there's significant funding available and grants available to support the long-term, our nursing homes and our hospitals, to be able to hire positions of need, like personal care assistants and home health aides and things of that sort. So that's just an example of what happened today. And so there's lots of opportunities for BCHIP to identify resources and then expand those collaborations in our community.
Yeah. And again, you talk about, okay, who at the county level, like the county is always saying we have workers, right? They have systems, they have employment, they have programs at Bucks County Community College for certain majors, where they guarantee you a job at the end. But if the healthcare systems don't know about that, then how are they going to take advantage of those workers? So that's great that you are once again sitting in the middle of solving that need for better, to better the health of everyone here in Bucks County. You can't go to the hospital if there's no one working. So
amen. So, and there's lots of great, grants out there for folks, for people themselves who want to go back to school. We talked about a couple of those before, or people who may not have finished a degree. And then there's great incentives for the employers to give them some money while people are getting trained. So it benefits the individual, and of course, like you said, ultimately benefits the health of our community. So it's good stuff.
That is amazing. Okay, so data and finding jobs. This is good. See, I boiled your whole strategic plan down to 2 topics.
Yeah, wouldn't that be great? The other part of our strategic plan is really just strengthening our legacy programs. So our legacy programs are ones that we've talked about: the smoking cessation program, the advanced care planning program. I just find it amazing that BCHIP's been doing some of this work. Well, gosh, the smoking cessation work for 25 years, right? And that we still have folks that say, oh, we didn't know that, there was a resource to do that in Bucks County.
Right.
Just really continuing to strengthen those resources and make sure that, I don't want anyone ever to say we didn't know those resources didn't exist. So whether they choose to stop smoking or not is an individual decision, but whether you know about the resources to help you is where I really feel we need to make sure we put some priority.
Great. Okay. Yeah. Because, and we've talked, right? It's also possible that reaching people on social is not the right path on certain programs. You guys are going to need extra funding, but everyone thinks that the only path is social or the only way is to pass out flyers. And so you need to really strengthen the efforts to find the people where they are, as I like to say.
And I got to be honest, I mean, of course, we're committed to social media. You know that better than anyone. But we have really had great success with just kind of boots on the ground efforts, visiting our local markets, visiting our grocery stores, visiting our pharmacies, Dunkin' Donuts, just all community boards where we can get information up. And so that requires resources too. And so we're pretty committed to doing that outreach, but we've been successful that way as well.
So besides that, I have to ask, what were the big takeaways from you of the strategic planning process for BCHIP?
That's interesting. I would say the biggest takeaways were what our community partners felt the value of BCHIP was truly an arm. We are the collaborator. We are the convener, and that they really valued that piece of what BCHIP can do. And I like that because I don't think right now BCHIP is really positioned to be a direct service provider most of the time for this work, but we are perfectly positioned to bring together the community benefit organizations, the health systems, the county government, the payers like our insurance companies, to bring all those folks to the table in a more intentional than it currently is.
It's amazing. Good. This is good stuff, Kim. Strategic plans are good for organizations.
Very good. Yes.
Sometimes executive directors would rather go to the dentist. It's like visiting, your accountant.
I loved the process. I mean, am I looking forward to doing it all the time? Maybe not. We're really committed to using it. That's the other thing. I know a lot of folks do it, but we're incorporating it into our team one-to-ones. We've incorporated it into our team meetings, and so that everyone is aligning their efforts with the strategic plan, either directly or indirectly. So we're pretty committed to really utilizing it.
Yeah, when I teach at Bucks County Community College, I teach an entrepreneur course, and we get there, everyone's like, oh, I need a 20-page business plan. I'm like, for what? You need a one-pager, right? You need something to follow so that you don't like, oh, I have to go look at my strategic plan to see how I'm going to follow that. Well, so good for you guys.
Well, thanks.
Okay. Anything else you want to tell us about the process or what's in it?
No, I think we've kind of really hit the highlights of it. Just the last piece of what we're looking to do is because BCHIP's grown so quickly within our organization or within the last few years, is just to really have organizational development. I feel like we grew really quick up, but now we need to settle it. We need some roots. We need to make sure we're putting processes in place and structure in place so that the organization is sustainable going the direction that we've laid. So looking forward to doing that. I mean, kind of looking forward to doing that. Right? It's like employee, policy and procedure manuals and employee handbooks and all that good stuff. So we need that work. Certainly not stuff I probably really look forward to doing, but I'm glad to be able to build the roots for the organization that it'll need to be sustained.
That's awesome. So you're sitting in the center of healthcare in Bucks County and you're building up your organization. You're doing exactly what you're supposed to do.
Yeah, I hope so. We're good.
Well, this was a tech disaster today, but I think we made it through. I am going to end the recording in a minute, and thank you. We will see everybody in 2 weeks again.
Thanks so much.